Hello viewers, I am Dr. Vennela, consultant ENT surgeon in Renova Hospitals, Langar House and Banjara Hills. Now let's talk about the pediatric infections and firstly coming to the tonsil and adenoid. So many kids parents come to me, they are very anxious about the tonsillitis and adenoiditis and let's talk about the etiology and pathogenesis and the treatment of the tonsil and adenoid. So firstly, coming to the anatomy of the tonsil and adenoid is a lymphoid tissue. It is present in every individual. It is present even in a child and it is present even in adult. It is a lymphoid tissue situated in the throat. Tonsil is a lymphoid tissue situated in the throat, whereas the adenoid is a lymphoid tissue situated behind the nose. So usually it is a seat of lymphocytes which helps in immunity for the patient. But sometimes it gets infected and it becomes a seat of septic focus. So then ENT surgeon has to treat the kid. So what are the symptoms of tonsillitis? The tonsillitis, the kids suffer a lot. They present with frequent fevers, recurrent throat pain and recurrent ear infections. And they have difficulty in swallowing and the child with adenoid cannot sleep in the nights. They suffer with sleeplessness and obstructive sleep apnea. That is cessation of breathing during the sleep. So the parents get anxious and they get worried about the child. Then they come to us. So usually what are the indications of the surgery and what are the indications of the medical treatment? So coming to the indications of medical management, it depends upon the infection. So first we have to treat the infection. We have to give broad spectrum antibiotics to prevent the pus coming out of the tonsils. If untreated, the tonsillitis can lead to complications. Mainly the complications in the tonsillitis reported are peritonsillar abscess, parapharyngeal abscess, and untreated tonsillitis can also lead to the kidney disease like acute glomerulonephritis. So the tonsillitis is one condition that should be treated promptly and it shouldn't be neglected. So, and the child can present with high fever, chills and rigors in acute tonsillitis and with enlarged lymph nodes. That means enlarged swelling in the neck. And coming to the adenoiditis, and there are types like acute adenoiditis and chronic adenoiditis. So if the adenoid tissue is large, it covers the nasopharyngeal airway. So it blocks the airway and the child can present with snoring and because of the blockage of the nasopharyngeal airway, and also if that lymphoid tissue blocks the eustachian tube. Eustachian tube is one tube which connects the throat and the ear. So if this adenoid tissue is also blocking the eustachian tube opening in the throat, it can cause ear problems. It can cause defect in the ventilation to the ear. Then the child can present with ear infection. It can present with accumulation of fluid in the ear and the recurrent ear infection. So adenoiditis also has to be treated. So coming to the preoperative assessment and coming to the indications of the surgery. So what are the indications of this surgery? Every child has tonsil and adenoid. So the adenoid grows till 11 years of age, and after 11 years of age, it regresses in size. And the tonsils, there are grades of tonsillar hypertrophy. So if it is grade 4 and if the tonsils are meeting in the midline of the throat, and the child can have difficulty in swallowing, and the child can have all that associated mouth breathing, snoring associated with adenoiditis, then the child has to be treated with surgery. So we have sophisticated instruments, the latest instruments right now in the well-equipped hospitals like Renova. So coming to the basic methods, we use cold steel instruments, and advanced instruments include coblator and harmonic scalpel and bipolar cautery and microdebrider. So I prefer using coblator in the pediatric age group because it minimizes the blood loss and it causes easy healing, and you can do as a daycare procedure, and the child can be admitted in the morning, and after surgery we'll keep the child in observation till evening, and the child can be discharged with no complications, and the post-operative pain will be less. Even the adenoidectomy also, It depends upon the grade of the adenoid hypertrophy, and it can be treated simultaneously. Adenotonsillectomy can be done simultaneously. So usually the parents come to us and ask, Madam, will the child has to be like treated with surgery only? Are there any alternate options other than the surgery? So will the medical management helps in these cases? Coming to the indications of tonsillectomy, if the child has recurrent episodes of tonsillitis in 3 months with fever, sore throat and all, and the recurrent ear infections and recurrent difficulty in swallowing, so then the child has to be treated with surgery. If the child has adenoiditis also along with tonsillitis, if the child has mouth breathing, if the child has snoring, all these are the indications for the surgery. So the parents have to consult the ENT surgeon, and they have to take the opinion regarding the management of tonsillitis and regarding the surgery.